Hello, everyone. This is Katsuo Academia. Today, we're going to put on our detective hats and dig into one of the most debated topics from the last few years, masks. So, what does the science actually say about them? Let's investigate.
So it all really kicked off with headlines just like this one, right? They were everywhere in early 2023. This conclusion came from a major scientific review. But here's the catch. It only looked at one specific type of study. And that, well, it caused a whole lot of confusion and led many people to just assume the science was settled.
But you know, in any good investigation, you have to look at all the clues, not just one. So, is the case really closed? Or did that one conclusion maybe miss a huge part of the story? That's what we're going to unpack in this explainer. Okay, let's dive in.
First things first, before we can even start judging the evidence for or against masks, we have to understand the crime scene itself. And that means getting a handle on how respiratory viruses really move through the air. You'll see this is the foundation for absolutely everything else.
So, for decades, the main idea was this droplet theory. The thinking was that viruses were basically hitching a ride on big, heavy particles that just, fell to the ground pretty quickly. That's why the focus was so heavy on hand washing and staying a couple of meters apart. But modern science has totally flipped that idea on its head. It's confirmed the aerosol theory, which shows that viruses actually travel in these teeny tiny particles that can float around in a room, kind of like smoke. And that changes everything. The focus shifts from surfaces to the actual air we're all breathing.
And here's a really simple way to get your head around it. Just think of it like secondhand smoke. If somebody's smoking in a room, you know that smoke doesn't just hit the floor, right? It fills up the space. Of course, the closer you are, the more you breathe in, but even if you're way across the room, you're still getting exposed. That is exactly how airborne viruses work. Okay, so if the real threat is floating in the air, then what makes a mask a useful tool? Well, it really boils down to two things, and they're both super important. First up is filtration. How good is the actual material at catching those tiny aerosol particles? And second is fit. How well does the mask seal against your face? Because if air is just leaking in and out the sides, it doesn't really matter how good the filter is. You absolutely need both of them working together. And this chart just lays it out so clearly. Not all masks are the same. Not even close. A simple cloth covering? It offers some protection, sure, but it's pretty low. A standard surgical mask? A step up, it's better, but a properly fitted N95-style respirator, which is designed from the ground up for both high filtration and a tight seal, offers a massively higher level of protection. So yeah, the quality of the tool you're using really, really matters. All right, so now we get the science of the scene. It's time to start gathering all the clues. You know, a good detective never relies on just one piece of evidence. Nope. They build their case by looking at everything they can get their hands on. So let's see how all these different clues build that bigger picture. And when it comes to science, the detective's toolkit is pretty big. You've got lab studies that test materials and airflow under controlled conditions. You've got observational studies that look at what happens in the real world with actual people. You have mathematical models that can simulate all kinds of scenarios. And of course, you have randomized controlled trials, or RCTs. People often call them the gold standard. But they have their own specific strengths and weaknesses, especially for something like this.
Now, let's look at a key piece of real-world evidence. There was this huge review in 2020 that combined the data from 44 different studies, all looking at what was actually happening out in the world. And they found a really powerful effect. Using masks and respirators was linked to an 85% drop in the risk of infection. I mean, 85%! That's a massive clue that suggests masks were making a real difference.
So you might be thinking, if the real-world evidence is that strong, why was there so much controversy? Well, it all circles back to those clinical trials, the RCTs. This is the evidence that was used to make that claim that masks don't work. So, what did they really find? And this is where the plot really thickens. A brand new, super careful reanalysis of all that trial data found that a lot of those original reviews had some serious flaws. It turns out they were kind of mixing apples and oranges, lumping different kinds of masks and different situations all together. But when they analyzed the data correctly, separating the signal from all that noise, one finding came through loud and clear. Consistent, continuous use of N95 respirators in healthcare settings was significantly protective. The scientists who did this new State of the Science review, well, they didn't mince words. This quote right here just perfectly sums up what they found. the whole idea that masks don't work wasn't really based on a lack of evidence, but on a pretty deep misinterpretation of that evidence.
Okay, but no investigation is complete if you don't look at the potential downsides, right? A fair analysis has to weigh the benefits against any real harms. So, what does the evidence say about the negative side of wearing masks?
It's so important to separate the facts from the fiction here. Science has documented some real, but usually pretty minor downsides. We're talking about things like skin irritation, getting a headache after wearing one all day, and definitely some real communication challenges, especially for people who are deaf or hard of hearing. But those more serious claims you might have heard, like masks cutting your oxygen, causing CO2 poisoning, or weakening your immune system, well, they've been looked at again and again, and they've been thoroughly debunked. So the takeaway here from all the comprehensive reviews is pretty clear. For most people, those big, scary harms that people are worried about are just myths. The documented downsides are mostly about minor discomfort.
So, we've checked out the scene, we've gathered all the different clues, and we've considered all the angles. I think it's time to deliver the verdict from our little investigation.
Let's wrap this up in our final report. 1. The threat is airborne. That's the bedrock science we have to start with. 2. Because it's airborne, fit and filtration are everything. A good respirator works incredibly well. 3. When you look at the totality of the evidence, all the different clues together, they point overwhelmingly in one direction. Masks are effective. And finally, 4. Case solved. That masks don't work claim was basically the result of looking at just one piece of the puzzle and reading it wrong. So maybe the most important takeaway is this. We've been asking the wrong question all along. It's not a simple yes or no. A loose cloth covering in a crowded, stuffy room isn't the same thing as a fitted N95 respirator in a hospital. The evidence is clear that the right tool, used the right way, in the right situation, is a really powerful layer of protection. So the real conversation we should be having now is about how and when to use this tool in the smartest way possible.
And that's the state of the science on masks. If you found this breakdown helpful, please subscribe to our channel and give us a thumbs up. We'd really appreciate it. Thanks for joining us.